You often see these dry, red patches on your child's arms, their legs, neck, and maybe other parts of their body. And they're itchy and can cause distress or discomfort to your child. Chances are, it's eczema. The important thing is that it's not contagious. Now, how can parents help? On the program today, we'll talk more about eczema and how you can address the skin condition, treat it, and prevent it from flaring up. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk on CNN Philippines. If you notice your child has dry, red, and bumpy patches on their skin, he or she may have a condition called eczema. Now, our guests are here today to tell us more about this condition. With us is Dr. Zarina Chavez. She's a dermatologist from the Medical City and the Rizal Medical Center. Also with us is Dr. Camilla Faye Ramirez Tuazon, who's a pediatric dermatologist from National Children's Hospital. Now, eczema belongs to an umbrella topic of atopic dermatitis, and most people develop this common condition as infants as well as toddlers, and the risk may start to drop off by the time they reach adulthood. Now, Dr. Chai, what are the main causes for this kaya para ma-aware ang ating mga viewers?
So, atopic eczema is actually a multifactorial condition, meaning there is no single cause that leads to the disease. Although, instead, there are several factors which come into play. So, this includes genetic predisposition. So, there's also the defects in skin barrier. Our immunity also plays a role, as well as environmental triggers.
Now, there are some risk factors. Of course, a lot of parents might want to know about the risk factors that make a child more vulnerable to this condition. Dr. Camille, let me ask you on this part, what are some of these risk factors na pwedeng present?
So as mentioned a while ago, atopic dermatitis or atopic eczema is actually a complex interplay of your genetic predisposition, environmental factors, integrity of your skin barrier, and even one skin microbiome. So 10 to 30% of atopic eczema patients, usually they have filaggrin mutation. That's the one responsible in holding on the integrity of her skin barrier. So that's one risk factor if they do have that mutation. Environmental triggers such as your irritants, allergens, microbes, and even mechanical injury. These are all some of the triggering factors that can help in the development of eczema in children.
Now, the constant itching, redness, and bumpy skin can be frustrating for both the child as well as the parent. And understanding all of this and the warning signs can help you get the care needed as soon as possible. Now, we mentioned a few symptoms earlier, but let's concentrate on infants for the time being. Dr. Camille, what does this condition look like in infants?
In infants, actually, it's more of the extensor surfaces that is actually, they do have lesions on the cheeks, the extensor surfaces, so that's how they look like. It's more crusty, sometimes it's more excoriated. And as mentioned a while ago, that they do drool, especially when they're starting to yung feeding nila. So sometimes you see it around the perioral area. So you see red, scaly, thin patches on the extensor surfaces, mostly also on the cheeks.
Now, Dr. Chai, when it comes to eczema, meron ba tong mild, moderate, severe when it comes to it presenting to the child? Meaning, could some of the symptoms be so mild na baka hindi mapansin ng parent na eczema na pala to?
Yes, that's correct. Some patients will just present with dry skin and very itchy skin without overt appearance of rashes. So those patients will not really complain or go to the clinic. But sometimes when they go for other reasons for consult, they say that, Doc, I noticed medyo dry yung balat ng patient or nung anak ko.
In today's reality, the constant hand washing and use of alcohols or sanitizers have become some of the triggers for breakouts of eczema. Now, Dr. Camille, could you tell us more about this? Meron bang option para sa mga bata na sensitive, nagkakaroon ng eczema when it comes to hand washing soap, sanitizers, alcohol, and things like that?
I think nowadays it's really still important that we tell them or we still educate kids to do hand hygiene. So, however, they're very sensitive when it comes to the ones they're using, especially those with fragrance. So maybe what we can do is to give them those synthetic detergents like those mild cleansers without fragrance and also less ingredients. And right after, we can tell them or also help them in applying their emollients or moisturizers every after hand washing so that they can also prevent having eczema on their hands or they can prevent having hand dermatitis.
Now, the itchy, dry, sensitive skin characterized by eczema can be mistaken for psoriasis or other skin conditions. We'll discuss how to tell them apart when we return. So stay with us on MedTalk Health Talk, only on CNN Philippines. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk on CNN Philippines, where caring is our calling. The chronic skin condition eczema can make your child's skin itchy, irritated, and inflamed. But several skin problems can bring about similar symptoms. An example of that is psoriasis. Dr. Chai, what are some of the symptoms of psoriasis that may be similar to eczema, and how can mothers or parents tell them apart?
Psoriasis is also an inflammatory skin condition or an immune condition, no? But usually the lesions of psoriasis are thicker rashes, and the scales are also very thick. So we usually see this on areas which are frequently exposed to trauma, such as the outer sides of the arms, the knees, the elbows, and also on the scalp. Also with psoriasis, there's frequently involvement also of the nails. So we see some findings in the nails.
Now, specific tests to diagnose eczema are still unclear. Dr. Chai, could you share your knowledge on how does a dermatologist arrive at the proper diagnosis of eczema? Meron bang specific test para dito?
Okay, so there is no specific laboratory test to diagnose eczema. It is actually diagnosed clinically. So we ask about symptoms of itching, about the course of the disease, whether it's recurrent. We also ask if there are members of the family with atopic conditions such as eczema, allergic rhinitis, and asthma. And then we look at the appearance and location of the rashes.
Now, while a cure is not the main focus of this, there are many things that you can do to reduce the symptoms and prevent flare-ups. And as we mentioned earlier, most children don't carry this condition throughout adulthood. Now, one of the things that your doctor might recommend is to avoid foods that can cause inflammation or that can be a trigger for eczema. Dr. Chai, what should be eliminated from a child's diet that may be a trigger for eczema?
So usually we don't really recommend elimination diet if we do not prove that it causes flares of eczema, because we don't want to hinder them from getting the nutrition from food. So it's not a routine for us to recommend elimination diet in patients with atopic eczema. But if proven, some which can trigger atopic eczema are eggs, nuts, those foods.
Now, Dr. Camille, pagdating naman sa mga triggers, what should parents be aware of or so that they could be avoided that may be a trigger for eczema?
Those that we do or we buy from the market, let's make sure that all we're using are mild products, non-fragrance, less ingredients as much as possible, plain as much as possible. Also, the detergents that we're using, we are advocating to do double or triple rinsing because it might also trigger their eczemas. Make sure also all the things they're wearing, mostly we can tell parents to wear cotton clothes and also their daily activities and we have to tell them to have a good hygiene, give them daily baths because, as I've said earlier, sweat can trigger their eczema.
Now, Dr. Camille, I'd like to ask, is stress a contributory factor? Pwede ba mag-trigger ang eczema ng isang bata due to stress? And if so, paano kaya ma-manage ito ng isang parent?
Yes, stress can really trigger ED, especially now they're doing homeschooling, like online classes. But what we do, and lately also guidelines do, or most of the studies would recommend multidisciplinary approach, and that is integrating like some psychological assessment during their clinic visits. We can do cognitive behavioral therapy to these kids, and also teach them to do some relaxation techniques whenever they have the urge to scratch. And then when they tend to be itchy, because stress really triggers itch, because somehow they do have the same pathway. And also aside from that, we do the habit reversal technique, that whenever they have the urge to scratch or itch, is that they will put their hands or sit on their hands and think of other strategies to divert their attention rather than scratching.
Now, we often see certain parts of the body where eczema is more pronounced. So this is the neck, the back of the elbows, even the back of the knees. Dr. Chai, bakit ito yung mga areas na focus ng eczema kaya?
Okay, so as Dr. Camille said, no, sweat is a very common trigger for eczema. So usually these are areas where that is occluded by sweat. So in these patients, we usually advise parents to make sure that it does not occluded, and make sure na lagi nilang papahiran yung area if there is already sweat on these areas.
Now, Dr. Camille, right now where a lot of kids may be taking their vaccine for COVID-19, because the rollout for the 12 to 17 age group is now underway. And sometimes, very rarely, but sometimes, these vaccines may cause some side effects. Now, can these side effects kaya ng COVID-19 vaccine, can they somehow be manifested through the skin? Can they look like eczema?
Some of them are scared, especially those known eczema patients already. They're hesitant to have, because some of them might think na baka mag-flare po yung eczema nila. We're here, that your board-certified dermatologist or your primary physicians and pediatricians to guide them, just in case, because still vaccine is more important as of now. So if ever they will have flare of eczema because of the vaccines, or maybe some of them will have manifestations of like morbilliform rashes or like exanthematous, we can always guide them. They can always see us and then help us alleviate their symptoms, just in case they will. But based from my experience in taking care of my ED patients who are already, who had their 12 to 70, those who are in that range, so far they're not having any symptoms yet.
Now, there are also some home care treatments that can relieve the itchiness and inflammation caused by eczema breakouts. More on this when we return. Your health is our mission here on MedTalk Health Talk. You're watching CNN Philippines. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. If your child is living with eczema, its symptoms could be affecting his or her quality of sleep, not to mention your own. The good news is there are many home treatments and medications available that can help prevent flare-ups. First of all, Dr. Camille, when it comes to home remedies, is this something that dermatologists would recommend? Is this something that is, for the most part, safe to use? And if so, what are some of these home treatments for children with eczema that is safe and recommended by the dermatologist to use?
So in treating eczema, we have actually basic management. That's giving them baths, giving them daily moisturizers, and avoiding triggers. As home remedy, I recommend also sometimes to those who can do it to do dilute bleach baths That's a home remedy. So what you do is you get a half teaspoon of your common household bleach bath and dilute it in 1 gallon of water, or to those with bathtubs, you get a half cup of a common household bleach bath and dilute it there with bathtub full of water. Ask them to leave it to their skin for 5 to 10 minutes and then rinse it, and then repeat it twice weekly just to avoid having skin infection.
Early on the show, we talked about foods that should be avoided. Now I'd like to ask Dr. Chai, are there foods that can help reduce the inflammation caused by eczema?
While anti-inflammatory diet is not yet routinely recommended in patients with atopic eczema, there are foods which can help reduce inflammation. And these are the foods that we generally regard as healthy foods, so which include fatty fish such as salmon, tuna, mackerel, also green leafy vegetables and tomatoes, fruits such as berries, strawberries, and blueberries.
Now, in terms of managing and treatment, there are also creams and over-the-counter medications that can help alleviate some of the symptoms. Dr. Chai, could you mention some of these and maybe some of the safety reminders as well whenever a parent goes out and looks for over-the-counter treatments for eczema?
We have several treatment options for atopic eczema. So we have anti-inflammatory creams or ointments. And usually these are available via your doctor's prescription. So we really discourage patients from self-medicating, especially with what we call steroid creams, because there are side effects which can result from prolonged use of these steroid creams. So aside from that, we can also prescribe other treatments such as phototherapy, which is basically available in some selected dermatology centers. This is just exposure to a certain wavelength of UV light. And then for those who have severe and unresponsive eczema, we can also prescribe tablets. Again, these are available through your doctor's prescription.
What should the parent of a child do kapag napansin niyang parang hindi gumagaling yung mga simptomas with the medication?
First, the parents should be able to identify triggers, because avoidance of triggers of eczema are very important in the management of these conditions. Also, if it doesn't improve with what was given to you by your doctor, then maybe it's about time to follow up with the doctor, because there are also other treatment options that we can give for these patients.
Now, eczema can also affect a child's self-confidence as well as their mental well-being. Because of the redness and inflammation, a child can get very self-conscious, and other kids might not also understand this condition and might react to it harshly or even negatively. Dr. Camille, do you have any tips for parents to help their children deal with these effects?
Check on them all the time. Tell them that even if it's hard to treat, there are some things that we can do to alleviate their symptoms, and also to reduce their anxiety. Make sure also to give them proper education, and just sometimes listening to all of them when they visit the clinic is all that matters. So sometimes just show them that you're there for them in this journey.
And with that, I'd like to thank dermatologists Dr. Zarina Chavez and Dr. Camille Faye Tuazon for sharing with us your very important insights. Marami pong salamat sa inyo. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk on CNN Philippines. We'll see you again next time.